I was a diesel mechanic at Sunbelt Rentals. I started when I was a kid. My grandfather used to work on cars all the time at the house, so I picked up from him. And then I started buying little Honda Civics here and there and making them faster than they used to be. So that Saturday I was getting my car clean. Then I told him I was gonna go get my friend's motorcycle, clean it, bring it back, clean it, and I guess that's when the accident happened.
I see a lot of motor vehicle accidents. I think motor vehicle accidents are probably our most common trauma activation.
That day I was riding normal, and a lady, supposedly she came out in front of me and stopped in my lane. So the detective said I laid the bike down, I guess, or went into the side of her or something.
Anthony, what we were told is that he was approximately a 26-year-old male, polytrauma patient that was a motorcyclist that was struck by a motor vehicle.
Supposedly I was dead, they said. I was DOA.
Once we got CAT scans, I knew his injuries were pretty severe.
My spleen ruptured, I had 4 broken ribs, liver got scarred, one of my kidneys is not functioning at all. My lungs collapsed, I had traumatic brain injury. The elbow punctured the skin on this side and my femur broke in half. Also with my hip detaching, breaking apart as well.
He came in as a high-level trauma, so they usually try to get all of the stakeholders involved right away. So orthopedics comes down to the emergency department, neurosurgery, trauma is running the show along with the emergency department.
What I was most concerned about when I first met him was his breathing. His oxygen was very low. So the first thing I did with Anthony was actually place a chest tube on the right side.
They needed to stabilize those other conditions first before it was safe for us to do anything for him. He needed pretty significant, coordinated specialty care from multiple medical and surgical services.
The lady that taught me how to do the walking her name is Diana, and she literally was by my side a lot. She literally was there in the morning. Much as I didn't want to wake up in the morning, she was there pushing me. And I'm still here walking, talking. I get to see my mom every day, get to see the rest of my family every day and friends.
The fact that his kidney has come back around and he's actually leading a meaningful, active life. It's great to see him in the office, and he's done remarkably well.
Seeing him today is the reason I decided to become a PA and go to PA school. Working in critical care and working in the ICU, a lot of the times our patients are very sick. And then when they do get better, we send them out of the ICU. So I don't get a lot of positive feedback on patients and see how they do down the line, but he's doing great. Being able to talk to him and shake his hand meant a lot.
He's a great example of why we do it, because we met him at probably the worst day of his life. We're not people that you want to see in the hospital. So to see him recover nearly fully, leading the life that he wishes to lead is really incredible.
This is a hard field to work in for everyone in medicine, whether you're EMS or a PA, a nurse, an attending physician.
The doctors always get a lot of credit, but it's a much bigger team that actually provides care from the patients.
Positive feedback and celebrating the lives we saved, I think, is really important.
There's a lot of people who do incredible work who you don't really know about that we get to recognize at an event like this to really show the breadth of the team that takes care of a single patient.
I'll say to folks at Northwell, I appreciate you guys. I appreciate them from the bottom of my heart. If it wasn't for them and God, I probably wouldn't be here.